Hi, I'm Dr. Kurt Woeller. I often get asked, with respect to kids on the spectrum, patients in my practice, or through my subscription website at autismactionplan.com through the parent forum. Parents will often come forward and say, my son or my daughter is having behavioral changes that have just come along all of a sudden. What can be going on? What might be happening, and how can we remedy the situation? And obviously it's a complex question, but there's a couple things I first think of. For one thing, behavioral change could mean what? Are they having aggressive behavior? Are they irritable? Are they agitated? Are they having more meltdowns? Are they stemming more? Are they having more sensory issues? So you're trying to break it down into what exactly is the behavior. Okay, aggressive behavior, irritable behavior, agitated behavior, etc. oftentimes can be associated with bacterial imbalances in the digestive tract. So I want to come back and think about digestive function. Does the child have a tendency to be constipated? Constipation can lead to behavioral problems and imbalances in gut bacteria. Are the stools loose? Was there somehow maybe a new infection acquired, and that might be contributing to the problem? On the other hand, if we have a child who's goofy, giddy, and silly, whose sensory issues are going up, whose self-stimulatory behavior is going up, maybe it's yeast. That's always a possibility because yeast often contributes to those types of problems. What time of year is it? Often in the summer months when things are hot, depending on where you are in the country or really where you are in the world, we can get an increase in allergies. Certainly we can see that in spring. And with spring and allergies, we often get behavioral problems because either yeast can become a problem and sometimes the bacterial imbalances in the digestive tract can become a problem too. Another thing to think about is, when is the behavioral issues occurring? Is it occurring before going to school or in the morning? Or happening when your child maybe gets home from school? Or is it happening at school or in their therapy sessions? Has there been some type of change occurring in their daily routine? I've often had kids who had behavioral problems because they're in a classroom and a new child comes into the classroom that they either don't like, or they're not getting along with, or there's some type of conflict. A new therapist, a new teacher. Okay, so it can break down just to something in their routine. Has there been some sort of change in their diet? Eating new foods or taking certain foods away that your child likes certainly can contribute to behavioral problems too. Have you added a new supplement? Oftentimes I'll see changes in behavior when new supplements are added. Oftentimes people will add too many supplements at one time instead of spacing them out every 2 to 3 days, introducing a new thing. And supplements sometimes can cause problems. So if you really have to be a detective in what is actually happening with your child and how long has that behavioral change been occurring. Has it been over a couple days, a couple weeks? And really try to piece together what may be going on, because it's not always biomedical. It could be situational. Like I mentioned, it could be something at school or in therapy, etc. So try and piece it together with respect to that, but hopefully this gives you some insight of what to look for. By the way, if it is something that might be tied to supplements, generally what I do is I'll come back and say, okay, what supplements have you added since the behavioral change started? And then I'll say, why don't you take those supplements out? Take all of those supplements that were new, wait 3 to 4 to 5 days and see if the behavioral change shifts, and then reintroduce those supplements one at a time, maybe sometimes at half a dose, and take it a little bit slower, because just that change alone may be enough for your child to handle whatever new program you're putting them on. Okay? Thanks.